So the next part is we're going to be talking to you about our apprenticeship. So my colleague Jenny, who is our autism lead, will be taking it from when I finished on the Dementia Apprenticeships to talk to you about our autism apprenticeships. So in terms of what we're going to cover, because we're quite time short, is that I'm not going to spend too long in terms of what exactly an apprenticeship is, except to say that this is mainly the journey through the apprenticeships. Endpoint assessments have been around for some time now, and it does make the apprenticeship much more robust in terms of objective second assessments. But the one thing that I really want to make you aware of is that in terms of the initial skills and assessments, every good training provider will undertake these. We will also undertake a separate assessment onto our pathways because they are higher apprenticeships. And we will be checking really through a piece of work that people do, whether they are appropriate for the level 4 or level 5 pathways, and really just so that we can honour them in making sure that we give them the right information, advice and guidance, because we don't want to set people up to fail. We want to make sure that it's the right programme for them. So what we're going to be talking about essentially is the training pathway up to endpoint assessment. So those of you that don't know us and don't know where we come from, I need to give you a bit of context as to why we've arrived at this today. We've been working in Hertfordshire for many years. In fact, it's been about 15 years. We've been commissioned by a local authority that has invested heavily over the years in dementia education. And through that process, it started off, they commissioned us almost 15 years ago, I think, for just 4 programmes. But we now have developed and delivered prolifically over 18 different programmes in dementia. And through that time, we were able to engage with the research, engage with our communities, and really evolve our offer. And in fact, when the core capabilities were introduced, we already delivered the full programme of the dementia core capabilities. And it was about 4 or 5 years ago that we started to do impact work, which is aligned to our social impact status. So we were looking at what programmes were making a difference, what we needed to change, what tools we needed to introduce. And we did really good work over those years. And I think our offer has been unique. The challenge for us has been is that when we want to take that good work elsewhere, we've not been able to, because it's been prohibitive, because we have developed and shared resources freely as part of our learning and development. Our infographics are shared all around the world. There's a cost to that. Our impact assessments, there's a cost to that, and we fund all of it. And it's been difficult for us to then compete with such small margins externally, where we've had the logistical challenges of having to pay trainers to travel. So that was all impossible to share this brilliant work with the world until the pandemic came along. And when the pandemic came along, what happened then was that we were able to do something with all of this great work that we've done over the years. So when the higher apprenticeships were decided, we thought, what a great opportunity to use government funding to develop the skills that people need to work in what is a very complex role. So as we started the development, the pandemic started, and throughout the pandemic, people with dementia have been disproportionately affected. In fact, 25% of all deaths were people living with dementia. And what happened during the pandemic is that a lot of brave care workers had to actually skill up very quickly, because they didn't always have access to their health colleagues. And as a result, people had actually quite traumatic experiences, and people did a fantastic job. But what was happening is that because 72% of people living with dementia live with comorbidity, people really needed the rapid development of health skills, and they needed the support around that. So when we're developing this programme, we are thinking about what is the context right now. We are acutely aware of the skills that people need at this time. So working with people living with dementia during this time hasn't been without its challenges. The challenges of social isolation, the use of technology, and we've been fortunate to work with some providers and some who are on this call who have done some fantastic work during this time, and really we've been able to tap into, and will continue to tap into, their knowledge around what's worked and what hasn't worked. So our apprenticeships are designed for pandemic, or they're designed for second waves. They're designed to develop organisations to develop resilience. So this isn't just about a dementia pathway. This is about a dementia pathway that is designed to meet the needs of our sector right now. And a big part of what we're doing is incorporating the use of technology, and I'll talk a little bit more about that. And it's thundering here, so I will be competing with the thunder noise, so apologies if you can't hear me. So we're offering 2 pathways for the dementia apprenticeships. So the lead practitioner in adult care, which is the level 4, and the leader in adult care, which is the level 5. And each of those are unique pathways. So for the level 4 pathway, there is a strong focus on reablement, but we're also at this level really encouraging our apprentices to really understand what national policy is, and to appreciate their role within that, because it isn't always joined up in terms of national policy and what people are doing on the ground. We're also training people to work very proactively around risk reduction, and I'll talk a little bit more about that when we get to the slides at level 5. We're also going to embrace the medical model, because people with dementia live with comorbidity. Medical model does have its place in dementia care, and we know that people working frontline with this group do need to be adequately trained and skilled in understanding the role that medical model plays to the support and care of people with dementia. We're also going to be looking on this programme, one of the units they have to do is around environment and technology. And with a real focus on technology, we have brought skills into our organisation where people are experts in the use of technology, and technology is moving really fast. Only yesterday I heard about a fantastic group of girls in Ireland who have won an international award on developing an app, Memory Haven app, that's got face recognition for people with dementia. What we're able to do is create in our programs peer communities outside of the virtual classrooms, where people are going to be able to discuss and share the use of those technologies. There's going to be a lot of learning amongst peer cohorts. So that's a very important point to make, because our apprenticeship programme is developed in a very different way to our standard virtual classrooms. And then finally, the reablement aspect is looking at what is reablement, what are the challenges of reablement with living with somebody that has dementia, and what are the possibilities, and taking a very holistic approach to that. So we are fortunate to be working with Life Story Network in partnership in the delivery of this. We're very excited about that. We're also hoping to be able to access other organisations like DEEP, who are the voice of people with dementia. So it's a joined up effort, this programme. So our apprenticeships have taken a slightly different approach, in that we work business to business for many years. We're acutely aware of the challenges that social care businesses face. And so what we've done with these apprenticeships, instead of just looking at what can the learner achieve during this apprenticeship, we've really taken the view of how can we support businesses and what is the contribution to the business. So we are going to be initially asking our level 5s to be mapping to their dementia capabilities, so looking at, what are the skills gaps in the organisations. We're going to be requiring them on this pathway to do a unit on managing quality. And we are going to be using some of the tools that we've developed over the years in our impact assessments to make available to wider organisations, so they can get a real measure of how their organisation is performing. We're also going to be encouraging people to be brave around technology, you know, not just virtual reality, but all kinds of technology, so that should there be a second wave, people are equipped, as people have been forced into the use of technology now, to use technology to help people connect with families, and also indeed to connect teams to each other. I know that a lot of organisations have used WhatsApp, for example, to help connectivity. As part of this project, also, everybody needs to do a service improvement plan. It's a requirement. So there is at the end of it, there will be some service improvement outcome. And there is a list of those in the information. We've got very comprehensive information about these programs. So if you are interested in receiving those for your service, you can just contact us. And then each apprentice will also be doing an intense case study review, looking at the assessment process with somebody living with dementia. They'll also be looking at the interventions, and they'll be bringing that with permission and anonymously to a peer group, looking at learning across organisations. There's very much about learning across organisations in our apprenticeship programme. So our level 5s are different in that the focus is much more strategic. There is the risks around dementia there's been a recent publication moving the risks from 9 to 12 now. The new ones that have been added are pollution, head injury and excessive alcohol use. This infographic here is a little bit out of date because it was literally just published last week. So we will be working with organisations to identify those that they are currently working with that maybe don't have dementia yet, but maybe at risk of dementia. And a lot of our adult social care community work with people with learning disabilities, people with mental health problems, those with diabetes. They may already be at risk of developing dementia. We will also be on our pathways. We'll be doing a lot of work on, one of the options is around how do we support relationships, and sometimes those relationships are very complex, and what is the law, what is our responsibility, how do we tackle those very difficult ethical questions. We're also going to be doing a unit on capable environments, and this is more than just looking at the dementia environment, but it's more about looking at the integration of the social and the physical environment working together. What is it that enables us to work proactively to minimise distress, essentially, to enable people to live independently? How can we work preventatively? And the last 2 units they do on this pathway is supporting multi-morbidity, which is a programme that we've been doing for a long time, and also end of life. So in terms of service benefits, there is a lot of work done around developing strong leadership skills, around emotional intelligence. We are training leaders to teach people about the joys of the work, not just the challenges, but the joys, and really teaching people how to feel and understand their feelings, and to be able to connect as a team and create a really positive learning culture. We're going to be able to train on our level 5 programs how to use data to deliver service improvement projects. And again, there's more information, the information that we're going to send, how to do mock inspections as a whole unit, and some expertise from people that have lived through the pandemic around contingency planning. We've got a whole section on expert by experience, where there's a whole month that's spent listening to blogs of people with lived experience, reading poems of people with lived experience, and thinking about how they can bring that more into their work. Again, there's a technological review in terms of thank you, Lorna, the review, the technology that's available within the service. And the final thing, which is quite significant for this day and age, is that on the level 5 programs, they are going to be doing business planning, market analysis, looking at why the provider down the road achieves this, and doing comparing and contrasting with a view at looking at diversification. Just as we have had to diversify over the last couple of months, the shape of the care sector is changing rapidly, not just because of the pandemic, because of other major incidents that we are potentially facing. And so we need to think about how we can together work differently, flexibly, and flex and bend really under the weight of it. Okay, and just my final point before I pass on to my colleague Jenny is that I'm currently undertaking a doctorate at the moment, and what I'm looking at is how do we improve the impact of our training in practice. And there are lots of things that we've not really had the opportunity to explore properly in today's session. But one of the things that we're looking to do is build our LMS so that it has app connectivity, so that people can download our tools and resources at the point of practice. What we want to be able to cultivate is the opportunity to reflect powerfully and have access to the resources and the tools that people need when they need them. This is about changing practice. So we are, we've got lots of lovely resources like this that we've developed over the years that act as good memory aids for organisations. They've been used in team meetings and in all different scenarios. So they will be used to improve the impact of our work.